Welcome to Micro Review. Today our topic of discussion is Clostridium tetani. Before going into further discussion, we must be knowing that Clostridium is having four different species. The Clostridium tetani, the Clostridium botulinum, the Clostridium perfringens and the Clostridium difficile. One thing to remember is that all these four species are having four things in common. All are spore forming, they are obligate anaerobes and they are forming toxins and they are all gram positive rods. If we talk about Clostridium tetani, we mentioned earlier that we would be discussing a particular bacteria under the headings of disease, habitat, transmission, pathogenesis, clinical findings, lab diagnosis, treatment and prevention. If we talk about the disease caused by the Clostridium tetani, it causes tetanus. T for tetani, T for tetanus. Its habitat is the soil and its transmission is via two things. One is the wound site, mainly the puncture wound. And a classic scenario is that a person is in a construction site and a nail penetrates the foot, and this is an example of puncture wound. And one other mechanism of transmission is skin popping. It is a way to introduce drugs subcutaneously into the skin by the drug addicts. If we talk about the pathogenesis of Clostridium tetani, which is very much important. So to begin with, what happens is that Clostridium tetani spores, as I mentioned earlier, that they are present in the soil. They enter the body via penetrating injury. For example, barefooted, rusty, dirty nail enters the skin. Spores germinate into bacteria. What happens is that germination is favored by the necrotic tissue and poor blood supply in the wound. Once it has been germinated, the tetanus toxin is produced, which is known as tetanospasmin. This particular tetanus toxin, which is tetanospasmin, is traveling to the spinal cord via the axons in a retrograde direction. When it reaches the spinal cord, it binds to the ganglioside receptors and it cleaves the snare protein, which is responsible for the mediator release. Now, when it cleaves the snare protein, it blocks the glycine and GABA release by the inhibitory neuron. Glycine and GABA are inhibitory in nature. So when the inhibitory mediators are not released, it will lead to uncontrolled firing of motor neuron, as a result of which there will be excessive contraction and spastic paralysis will occur. One thing to remember is that in Clostridium tetani there is spastic paralysis, whereas in Clostridium botulinum there is flaccid paralysis. These two things are very much important. Moving on to some features of tetanus toxin, we should be remembering that tetanus toxin is an exotoxin, polypeptide in nature. It has one antigenic type, whereas the toxin in Clostridium botulinum is having 8 antigenic types. It is a protease and it cleaves the protein involved in the mediator release. As I mentioned earlier, that it is going to cleave the snare protein, which will block the glycine and GABA release by the inhibitory neurons. Now, if we talk about the clinical findings, we have discussed one clinical finding, which is the spastic paralysis. One thing to remember is that the toxin it is producing is tetanospasmin. The word spasmin itself suggests that it will lead to spasms, muscle contraction, rigidity, spastic paralysis. All come under this particular heading. And the classic symptoms and the classic findings that we see is trismus. T for tetanus, T for trismus, which is actually locked jaw. The jaw muscles are rigid and they prevent the mouth opening. And one more important finding is rhizus sardonicus, which is actually a characteristic facial representation, or we would say forced grin, due to spastic facial muscle paralysis. And the third important clinical finding is opisthetonus, which is exaggerated arching back due to spasm of strong extensor muscles of the back and neck. These two muscles, extensor muscles of the back and neck, are contracted, as a result of which person is hyperextended. And the fourth is the respiratory failure. If we talk about the particular treatment of tetanus, first of all we have to clean that particular wound. Then we give antibiotic, which is penicillin G or metronidazole, and then a tetanus immunoglobulin is given, which is actually antitoxin. It is having a function of neutralizing that particular toxin, which is tetanospasmin. One thing to remember is that this tetanus antitoxin or tetanus immunoglobulin only binds to that toxin which is circulating in the blood. It is not going to bind to that toxin that has already reached the spinal cord and is performing its function. It is just going to inhibit that particular toxin that is just only circulating and has not reached the spinal cord and has yet not started to perform. It has no effect on those that have already reached. And for that particular purpose, we give spasmolytic drugs to prevent the spasm, benzodiazepines, and neuromuscular blockers until the toxin wears off. One more way of prevention and treatment is that we give a tetanus toxoid used for the vaccine. And respiratory support should also be given because any sort of spastic paralysis in the respiratory muscles will lead to death. So we give respiratory support for maintaining adequate airway. Now, one important point is that neonatal tetanus is a type of tetanus in which this particular bacteria enters via the contaminated umbilicus or the circumcised wound. If we talk about the lab diagnosis, there is no microbiologic serologic test. One thing to remember is that Clostridium tetani has a terminal spore, which is a tennis racket appearance. I forgot to mention it in the features that Clostridium tetani is having a tennis racket appearance because it is having a terminal spore. For example, this is Clostridium tetani. So this is a terminal spore which just resembles a tennis racket. This is a tennis racket appearance, right? So on microscopy we see tennis racket appearance. If we talk about the prevention, we have to prevent this particular disease by giving vaccination. Immunization with tetanus toxoid vaccine in childhood and every 10 years. What is tetanus toxoid vaccine? It is actually a formaldehyde treated toxin. And this particular vaccine should be given along with or in combination with diphtheria toxoid and acellular pertussis, which is also known as diphtheria toxoid acellular pertussis DTaP. There are two situations of a trauma. Either it is a minor trauma or a major trauma. If it is a minor trauma, you have to do two things. First, you have to clean the wound and then you have to give a tetanus toxoid booster. And if it is a major trauma, then you have to do four things. If there is gross contamination, you have to clean that particular wound. You have to give the tetanus immunoglobulin, which I mentioned earlier was an antitoxin and has the effect of neutralizing the circulating toxin. This particular antitoxin is not given on one side. Half of the immunoglobulin is infiltrated in the wound and half of the immunoglobulin is injected intramuscularly. This thing should be noticed. This is important. And then you have to give a tetanus toxoid booster vaccine and you also have to administer penicillin. Since it is a gross contamination, so you have to do gross prevention, right? Inject the this is just a note that you have to inject the immunoglobulin at a site other than tetanus toxoid, right? And this particular administration of both immunoglobulin and tetanus toxoid is a good example of passive active immunity. This brings us to the end of this topic, which was Clostridium tetani. Hope it explains. So to summarize Clostridium tetani, you have to know that Clostridium tetani are anaerobic spore forming gram-positive rods and they are having a characteristic tetanus appearance. The disease that they cause is tetanus. Transmission is via the two routes. The wound site, either you are walking barefooted or you are on a construction site. Puncture wound is the main thing, and skin popping in drug addicts. Habitat is the soil. Pathogenesis is very much important, that when the spores enter via the penetrating injury, they germinate, they produce the toxin which is tetanospasmin, which travels to the spinal cord, cleaves the snare protein, inhibits the glycine and GABA release, which were inhibitory neuron, as a result of which there will be uncontrolled firing of the neuron leading to spastic paralysis. You have to remember that spastic paralysis in Clostridium tetani, flaccid paralysis in Clostridium botulinum, right? If we talk about the clinical findings, there are mainly four clinical findings. One is the spastic paralysis and three are having very unique names. One is the trismus, one is the rhizus sardonicus, and one is the opisthotonus, and the respiratory failure. If we talk about the treatment, you just have to clean that particular wound, you have to give the antibiotic, you have to give the tetanus antitoxin, and the tetanus toxoid vaccine is also given for the treatment as well as for the prevention. And one important thing that you have to remember is that on microscopy we see tennis racket terminal spore appearance due to terminal spores, and the organism enters via contaminated umbilicus or the circumcised wound in case of neonatal tetanus. Hope it explains.